emergency room are increasing every year in Lafayette.
Well, doctors say they've seen an increase since the Affordable Care Act deadline in March. They say it's too hard to say that's the exact reason for the spike. News 18's Elizabeth Rentschler has more on why.
It's a number that continues to grow. Every year, more and more patients are visiting emergency rooms across not only Lafayette, but the entire U.S.
When I started emergency medicine, there were about 95 million visits a year in the country, and now we're in the 120 million visits a year.
Dr. Mark Estes has worked in emergency medicine for 15 years. He says he's personally seen the number of patients grow since the Affordable Care Act deadline back on March 31st, but he admits it's impossible to say that's the exact reason for the increase.
That would require me knowing ahead of time whether or not that person had health insurance pre-March and obtained it strictly as a result of the requirement by the law, and also whether or not they were seeking health care now and had put it off previously as a result of not having had health insurance.
Instead, Estes attributes the spike to a combination of factors.
We're aging as a population. There's 10,000 people a day that hit retirement age, so that means as we age, we tend to consume more health care. And honestly, we're not as healthy or as fit as a nation as we probably once were.
Estes says on average, patients at IU Health Arnett are in and out of the ER in 17 minutes, but that's not the case everywhere. He says patients coming to the ER for non-emergency related injuries can often cause congestion.
If your child has a sore throat, if there's a rash, if there's an ear infection, cold symptoms, those kind of things, those are all very appropriate for your primary care doctor at the urgent care.
Estes says knowing the difference between what constitutes a trip to the ER or immediate care can often save you time and money. For more on which injuries require which type of visit, log on to WLFI.com. Elizabeth Rentschler, News 18.